Hi, I'm Shane Bales, Doc Hockey for Pro Action Sports Injury Clinic. Today I wanted to talk about PAILs and Rails and an introduction to it. So these are exercises that help increase range of motion where you might be lacking range of motion. And we want to create strength and better performance in these ranges. This was created by Dr. Spina from Functioning Anatomy Seminars. He's the creator and president of this group, and he's done a great job with research and proving these techniques as valid things to do to help increase range. Okay, so the first thing is PAILs, which is progressive angular isometric loading. All right, that basically means we're putting pressure onto a range and then we're relaxing it, trying to get a little bit further with it. Doing it isometrically, which means there's less inflammation caused into the joint and strain in the muscle. The Rails is regression angular isometric loading, which is basically contracting the muscles to shrink the angle and actively making the range better. Okay, we're going to go through what the type of repetitions and the amount of holds that we want to do it. So when we're looking at PAILs and Rails, we want to start out with passive stretch. Okay, so a passive stretch, we want to hold it for about 2 minutes. Okay, I know it seems like a long time, but we go to our end range and we hold that passive stretch for about 2 minutes, working on diaphragmatic breathing. Okay, and we're doing 4 counts in, so inhale for 4 counts and exhale on 8 counts. Okay, and we're really focusing on breathing into our diaphragm, creating a nice brace throughout the body, which is what we call irradiation. Now, irradiation is bracing, okay? But we're bracing the whole body, so not just our core, but all the way through all of our joints, except for the joint that we're actually working, because if we want range in that joint, we don't want to have that being as stiff as the rest of the body. But we always have irradiation in through the body so that the stiffness is actually put into the joint, and as we put the stiffness in the joint, it actually helps us know where we are in space so the range can actually be increased and stop with the stretch reflex that often limits our ability to have better ranges. Okay? So after we do the irradiation and we have that passive stretch, we go into our first PAILs contraction. Now, PAILs contraction is basically going to that end range and actually going and putting tension or contraction backwards from where the range has gone. So if I'm twisted this way, my PAILs contraction would be going opposite way. So if I hold myself here from going opposite way, I can put an isometric contraction without having to turn. Okay, so that's one thing that we would do with that. Now, after we hold that for another 2 minutes, then we go to our Rails. Okay, our Rails is the regression part. So if I turn this way as far as I can, and I did PAILs going back that way, my regression angle would be this way here. So the angle here between the shoulders and here. So I'm actually using my muscles to contract it further. Okay, and we always have that kind of bracing, but we're contracting further to try to get more range. After we get our new range, we're going to go and shrink it more to see if we can get more passive stretch. So we go even further. Okay? So I'll show this kind of thing with a 90-90 position. So we're here, okay? We're at 90-90 position. All right? As I go forward, I want to feel it in the back of my capsule. So in my hip capsule, which is back here in the back part. So I'm feeling that by going forward. I could go further forward here, but I'm actually getting more range just through my lower back, and that's not the kind of joint that we want to be working at this time. So I go forward here, my passive stretch is here, I hold that for 2 minutes, all right? And that's basically bracing through the whole body, through the leg, through the core. And if I push my leg into the ground, resisting my ability to go forward, that's my PAILs contraction. So on my open angle, which is kind of down to the bottom part of my leg and then coming up here, this is my open angle, all right? So after I do that for 2 minutes, then I go into my Rails contraction, which is basically me going forward, right, and contracting my hip flexor, and I'm trying to lift my knee and my ankle off the floor to make that range even bigger, okay? If I can't lift the leg, that's okay. It's the intention that matters, right? And then after I do that for about 10 to 15 seconds, which is a very big contraction, and you should be really tight through everything else. Like you should feel the contraction through the muscle. You should feel tired, all right? And as I go forward then, I should be able to get a little bit better passive stretch, and we repeat that. You may not have to hold the second trial or set for as long because you've already done it for a little bit of time, so you're already kind of warmed up into that area, so you can do it a little bit less time. So if we can remember what we're talking about here, so we have our PAILs Rails, 2 minutes of passive stretch, okay, with our diaphragmatic breathing. We have our bracing through our whole body as we do PAILs, which is the isometric contraction for 2 minutes, and then we go to the regressive angle, which is the small angle of the muscle contraction for 10 to 15 seconds, and we'll repeat this for usually about 2 to 3 sets, and that's about all you're going to get out of it. So hopefully that helps sum up what PAILs and Rails is. I'm Shane Bales, Doc Hockey. Have a great day.